When you hear AEFI, Adverse Event Following Immunization, think patient safety and public trust. An AEFI is any untoward medical occurrence following immunization, not necessarily caused by the vaccine. It can be any unfavorable sign, symptom, abnormal lab result, or disease after a shot. Robust AEFI surveillance detects problems early, corrects errors, guides causality, and maintains public confidence. India's national guidelines, updated in 2024, make this a core program function. Minor events are mild and self-limiting, like local pain or low-grade fever. Severe events are more intense, requiring medical attention, such as high fever or febrile seizures. Serious events result in death, are life-threatening, require hospitalization, or cause significant disability, triggering immediate reporting. Next, the CIOMS WHO cause-specific categories from the 2012 framework are foundational. Vaccine product-related reactions are due to the vaccine's inherent properties, like transient fever after a pentavalent dose. Vaccine quality defect-related reactions are due to a defect in the vaccine or its delivery device. Immunization error-related reactions are caused by inappropriate handling, prescription, or administration and are preventable. Immunization anxiety-related reactions are driven by fear or stress of the injection, such as vasovagal syncope. Coincidental events have only a temporal association, unrelated to the vaccine, error, or anxiety. Surveillance ensures timely detection, investigation, causality assessment, error correction, and communication to sustain community trust. India has a multi-level system from session sites to national, coordinated by the National AEFI Secretariat for Investigation and Data Management. Everyone reports: medical officers, private practitioners, ANMs, ASHAs, and pharmacists. All AEFIs are reported, with serious AEFIs and clusters reported within 24 hours. The C.R.F is a rapid notification tool completed by a doctor and sent to the DO within 24 hours, who then uploads it to SafeVac within the next 24 hours. Detailed follow-up uses the case investigation form submitted within 21 days. The reporting flow is Session Site Medical Officer DO State Committee National AEFI Secretariat. For example, a foreman told with fever after a pentavalent dose with no red flags is a minor vaccine product-related event. The C.R.F is for rapid notification of serious events within 24 hours. Investigation of serious AEFIs involves verifying diagnosis, gathering clinical notes, recording vaccine details, auditing cold chain, checking for errors, and collecting samples. Programmatic prevention means zero tolerance for immunization errors following the 5 rights: right vaccine, dose, route, site, and person. Always check expiry and VVM status. Reconstituted vials must be used within 4 hours. Protect freeze-sensitive vaccines. Never use expired, freeze-damaged, or VVM discard point vials. Use the correct diluent. The VVM shows cumulative heat exposure. Discard vials if the inner square is at or beyond the discard endpoint. Causality assessment in India uses district, state, and national AEFI committees and the WHO algorithm. Final categories are consistent, indeterminate, inconsistent, and unclassifiable if data are insufficient. 2 adolescents fainting at a school vaccination, recovering quickly with visible anxiety, are classified as immunization anxiety-related reactions. Pre-session counseling, seated vaccinations, and observation reduce such clusters. For minor reactions, reassure caregivers, advise paracetamol for fever above 100.4 degrees Fahrenheit and cold compress for local pain. Recognize anaphylaxis early, sudden airway, breathing, or circulation compromise. Administer adrenaline 1 to 1000, 0.01 milligrams per kilogram intramuscularly, maximum 0.5 milligrams, repeating as needed. India empowers frontline workers with an age-appropriate IM dose of adrenaline, and every session must have a checked AEFI kit. Tertiary prevention involves transparent communication, rapid corrective action for errors, and timely feedback to field workers. Causality categories in practice: consistent, indeterminate, inconsistent, unclassifiable. The aim is learning, not blame. Definition: not all post-vaccination events are caused by vaccines, quote the WHO wording. Classification: no severity buckets and the 5 CIOMS WHO causal groups. Reporting: C.R.F in 24 hours, DO verifies in 24 hours, C.I.F within 21 days, through SafeVac, Flow his session Mo Deo State National Secretariat. Prevention: the 5 rights, check expiry and VVM, protect freeze sensitive vaccines, use correct diluents, and counsel to reduce anxiety. Management: reassure minor reactions, IM adrenaline for anaphylaxis, maintain ABC, oxygen, urgent referral, keep a ready AEFI kit. Can you now write a short note on AEFI classification and reporting with India-specific forms and timelines? If so, you're exam ready and practice ready.